Alright, how's it going, everybody? Final presentation for the semester, and we're going to be talking about aircraft pressurization. Alright, so here's a game plan. We've got it broken down into three main sections. First, we'll start off by talking about why we need pressurization in the first place. Then we'll talk about the isobaric pressurization system. Now, there are three different types of pressurization systems. Some are found on spaceships, some are found on military aircraft, but isobaric is the one that is used for aviation or general aviation, airlines or GA. So that's the one we're going to talk about. And then finally, we'll talk about decompression. And that's probably where we're gonna end up spending most of our time and in the talk here. All right, so first off, why do we need pressurization? Well, as we climb, atmospheric composition doesn't change. So if we look over here at the left side of the screen here, we can see what the atmosphere is composed of. So it's mostly nitrogen and then some other trace gases, and then oxygen is here in the purple. So this pie chart isn't going to change as we ascend in altitude, but the space between those oxygen molecules is going to get greater. So if you think about it, down here at sea level, or roughly sea level, like 700 feet MSL, you can envision these oxygen molecules really tightly packed. So every time we breathe in, we're getting a lot of those oxygen molecules into our lungs, and it goes into our body, and we're fine. We're not hypoxic. Whereas if we go up in altitude, and I'm sure if you've gone out to Colorado or any place high, you've experienced this. Man, I get shortness of breath really easily. I feel like I can't catch my breath, something like that. What that is, it's not that there's less oxygen up there. It's just those oxygen molecules are more spaced out, right? So when we breathe in, we're only getting in a few of those oxygen molecules. So again, that's why we need pressurization, is because as we ascend, with those oxygen molecules getting more and more and more spread out as the pressure decreases, we get less oxygen every time we breathe in. So we need to find some sort of way to compress those oxygen molecules so we can get a full breath when we breathe in. So that's why we need pressurization. So if we look at that, this brings up an interesting concept called TUC, or time of useful consciousness. So we can see here that as we increase in altitude, our time of useful consciousness, so our time for us as pilots to be able to effectively operate, we can see that here. So at 18,000 feet, we can effectively operate for 20 to 30 minutes before we start to get really hypoxic. And if we look down here at the very bottom, at 50,000 feet, it's 9 to 12 seconds where we can be effective. So you can really see by this graph or this chart that the higher you go, the more important it is to either be on oxygen or be in a pressurized aircraft. And again, this is super important to keep in mind when we start talking about decompression, because what happens if we're at a normal cruising altitude, 35,000 feet, boom, we have a rapid decompression, we lose all of our pressurization. We might have 15 to 30 seconds to figure our game plan out before we lose our effective consciousness. So this is really, really important stuff here for us as pilots, especially if we're wanting to make a career out of it. Alright, so we'll kind of talk about the isobaric pressurization system here. Just give you a brief overview. Now obviously, depending on what you get into when you're flying for an airline, or if you're flying private, Part 91, flying a jet or something like that, every aircraft's going to have a slightly different system. So this is just generally kind of how it works. And then obviously as you go through training and go through type school, you'll figure out how your airplane's specific system works and the nuances and differences and all that jazz. So the key components, we have two big compressors out here on the wing. Those are the engines. So the compression of the air, that compressive force, comes from the engine. So in most engines there's going to be a little nozzle in there, and that's That's where it's going to compress the air. Now, obviously, that air coming from the engine, it's pretty much the dead center of the engine, it's really, really hot. And we obviously can't pump, how hot is engine air? 1,000 degrees, more than that. We can't pump super hot jet engine air into the cabin. We'd melt everybody's skin off. So we need some way to cool it down, and that's where the pack comes in. So the pack cools the air, okay? And then after the pack, it goes into a distribution manifold. Now this will take it to whatever part of the aircraft needs to be pressurized. In a commercial airliner or passenger airliner like this, it's typically going to be your cockpit, the cabin where the folks are, and then maybe a couple of the baggage bays down there. If you have pets or something like that down there, you want that pressurized as well. And then finally, we have the outflow valve right here. Now this is what regulates how much air. Let me see. What's a really good way to say this? Well, I guess it just regulates the pressure that's in the cabin or in the airplane. It regulates the differential between the pressure inside of the plane versus the pressure outside of the plane. And here's a picture of what that looks like on a 747. This is that valve, so it'll open and close on different parts of the flight, and we'll talk about that a little bit here. We'll talk about that outflow valve and how it functions and what position it's in on different parts of the flight. So on the ground here, we can see that the outflow valve is fully open. So the pressure inside of the plane is going to be the same as the pressure outside of the plane with this pressure valve open. What's a good way of saying this? Oh, all right. So I suppose, imagine if you had, this will work. If you had the heat in your car on for your entire drive home and you let it get really, really hot in there, and then you were to open up your door, all of that heat's going to escape, and eventually your car is going to be the same temperature as it is outside. That's exactly what's going on with this outflow valve here, is that we open this thing up and it lets that air go between the airplane and the outside atmosphere. So it allows the pressure to be the exact same inside as it is on the outside. As we take off, that outflow valve is going to be partially open. As the air is getting shoved into the cabin, it's allowed to escape, but not as quickly as it's getting packed in. So the result is that our cabin's going to increase in the altitude, but it's not going to increase at the same rate. So what I mean by that is, say we're making a climb up to 30,000 feet, and we're climbing at 1,500 feet per minute. The airplane is going to climb up at 1,500 feet per minute, but what we're going to feel like inside, the cabin pressure is going to climb at, say, 200 feet a minute. It'll meter it in such a way that right as you hit 8,000 feet in the cabin, it stays there. All right, next one, cruise. The outflow valve is going to be fully closed, and pressure inside the aircraft increases. And again, once we get to a cabin pressure of 8,000 feet, the system will maintain that inside pressure as the climb is continued. And we can see that by FAR 25-841. Pressurized cabins and compartments to be occupied must be equipped, yada yada yada, to not be more than 8,000 feet at the maximum operating altitude. So that means that while we're inside of the aircraft, it can't feel like it's more than 8,000 feet up there. And then as we come into land, during the descent, it'll close so the pressure inside increases, and then on the ground, it'll open again to allow the pressure to equalize. So now we can talk about decompression. There are three types of decompression. We have slow. This would be anything like a small leak or small crack in a window. Maybe the door seal isn't sealed totally 100%. And because it's a small leak, it's going to be relatively imperceptible. And don't kind of push that to the side, because slow decompressions are extremely dangerous, and potentially even more dangerous, because we might not realize that we're in a decompression, and by the time we do, it'll be too late because we're already incapacitated by hypoxia. Whereas if we have like a crazy rapid decompression with a loud bang, you know right away that you're experiencing decompression and you're going to take action. Whereas with a slow decompression, it's more benign and you may not even realize it until it's too late. So here we go, rapid decompression. This would be where the cabin pressure increases 7,000 feet per minute. Typically associated with it would be a loud bang, and then we'd actually have a fog that's created in the cabin from that extreme pressure, humidity, and temperature change. And then finally we have our explosive decompression. This would be a decompression that happens in a half second, like this flight for, I think it's Aloha Airlines or some airline down in Hawaii. They had this happen in flight, and surprisingly were able to make it back on the ground. So factors that affect the rate of decompression. So what is going to determine how fast our plane decompresses? The first one is going to be the size of the opening. The bigger the opening, the faster that pressure is able to equalize or leave the cabin. The size of the cabin, right? So the bigger the airplane is, the bigger the cabin is, the longer it's going to take for that pressure to equalize inside and outside. The third one would be pressure differential. What is the difference between the outside and the inside pressure? The greater that is, the faster that pressure is going to work towards equalizing. The third one would be altitude. The higher up we are, the faster our plane's going to want to decompress. And finally, the last one would be pressure ratio. How much air are our engines packing into that cabin? If they're not packing in a whole bunch, then obviously it's going to take a little bit less time to decompress. Whereas if they're packing in a whole bunch, they're ramming air into that cabin, it's going to take a little bit longer for that airplane to decompress. So some phenomena associated with decompression, just so we're aware of this. So, if we do experience rapid or explosive decompression, obviously it's going to take us by surprise, but we'll semi-expect what's happening. Fog, flying dust and debris, cold temperatures, right? If we're up at 35,000 feet, it's going to be really, really cold up there. Wind blast, obviously we're going super fast, and noise is going to be associated with that as well. So it's going to be a chaotic environment, and our body's going to be wanting to shut down, so we're going to need to remain in there and get that oxygen mask on so we can handle the situation. Some of the physiological impacts of decompression. What's going to happen to our body when this occurs, or if it occurs? The first one's going to be hypoxia. So hypoxia is a state of oxygen deficiency in the blood, tissues, cells, insufficient to cause an impairment of body functions, and that's how the FAA defines it. 20% of the oxygen we breathe in goes to the brain. So if we have less oxygen coming in as a whole, the first thing that's going to go is going to be our judgment. If our brain isn't getting as much oxygen as it needs, it's going to be very difficult to make decisions. The second one, hypothermia. Again, it's going to be really, really cold up there. I mean, imagine climbing up to the very top of Mount Everest in whatever you wear as a pilot. You're buttoned down in long pants. You're going to freeze very, very quickly. Third one's going to be decompression sickness. So nitrogen in the body is going to form bubbles, and it's painful, very, very uncomfortable. Not an immediate threat, though, but could have some long-term, lasting negative side effects. The fourth one, trapped gases. So the the sinuses, we have these areas up here in our nose. If we have any sort of sinus block or anything like that, where we have some air stuck in there, if we suddenly decompress that could really cause some potentially damage up there, but definitely a lot of pain if it's trying to expand and it's unable to. The middle ear, the way the anatomy of the ear is laid out, it allows air to escape out of the ear, but has a hard time allowing air back in to the ear. So this is more of an issue on descents, but it can still definitely, I mean, if we experience a decompression, we're going to want to descend very quickly. So our ears are going to probably hurt real bad as we're coming down. Our teeth, surprisingly enough, if we've recently had a filling or something like that and there's a little bit of air stuck in there, it could actually blow that filling out. And then fourth, the GI tract. So this is literally, I mean, the definite version of trapped gases. If we have some gas, typically we get rid of that by, flatulence or belching or something like that. So if we have these gases trapped in there and we undergo a decompression, that's going to want to expand even more, and it's really going to hurt, and people have even been known to pass out from it. And then final physiological impact of decompression would be hyperventilation. It's a very stressful, very high energy situation. And some people, their reaction to high stress situations is to hyperventilate. So we'll want to keep the breathing nice and slow and controlled and normal to try to reduce the impact of hyperventilation. So how do we handle a decompression? First things first is we need to don that oxygen mask. Again, going back to that chart with the time of useful consciousness, if we're at 35,000 feet, we're not going to have too long before we're pretty much useless. So the first thing we need to do is don our oxygen mask. After that, get back in control of the aircraft and then descend to a lower altitude, preferably 10,000 feet or below. Now it's going to be really cold up there, so the faster you get down, the faster you'll be able to not freeze. And again, the systems on most airliners, they only provide oxygen to the occupants for, maybe 9 minutes or so. So it's really, really important that you get down very, very quickly. And then again, number 4, land as soon as possible. So don't continue on to, your destination. You need to get on the ground because some people could have some serious medical conditions. Again, we're talking about those trapped gases and whatnot, and the potential for hypoxia, nitrogen poisoning. So again, that brings up number 5, seek medical attention. So as you're coming down, you're talking ATC, make sure that they have the ambulance there ready for your passengers or potentially even you. Alright, that's it. So here are my sources. The FAA produced a really good video that helped out with this one. JXJ Aviation produced a good video. The CFR, Code of Federal Regulations, can't give a talk on aviation without quoting them. And then the FAA has a really good airworthiness directive, and that's linked up here as well. Alright, well, thanks for watching, and I hope you got something out of it. Alright.